Today we're going to quickly review cleft lip and cleft palate. Now, why are these important? Because if you're thinking about a subspecialty like plastic surgery, you're going to need those embryology, and more importantly, for your step 1 exam, they prefer to connect embryological development and pathology in relevant clinical vignettes. So this is something that they can definitely use. Now let's review quickly the normal. So the normal, as you can see here in this image, this is the embryological face, approximately 5th week. Not the best image, but it is a pretty accurate representation of the things that you need to know. You have a frontal nasal prominence, the front and the nose. You have the maxillary process here and here. And this makes sense because this is the upper part of the jaw, so the maxilla is the upper part of the jaw, and the mandibular process, which is the lower part of the jaw. And you can see here there's also a nasal pit, and the nasal pit is just an invagination of the nasal placoid, which is ectoderm, that occurs around 5th week. And this is an important step here because this invagination of the nasal placoid forming the nasal pit in the 5th week gives you the medial nasal prominence here in white and the lateral nasal prominences, which are also in black. And this is seen on one side and on the other side. Now, why is this important in the pathology and understanding of cleft lip and palate? Well, because as you can see here, in the next 2 weeks, these maxillary processes increase in size and grow in a medial direction. And this causes the compression of the medial nasal prominences toward midline. As you can see here, these arrows are representing that. And the medial nasal prominences will eventually fuse with each other. And you can see here that they fuse. And the maxillary prominences, processes, or prominences, same word essentially, I apologize if I interchange in between the two, will also fuse with the medial nasal prominence. As you can see here, they fuse here. So the fused medial nasal prominences grow downward to give rise to the intermaxillary segment. And it's called the intermaxillary segment because it's in between the maxillary processes that we just had push the medial nasal prominences together to form this one continuous structure. And the intermaxillary segment will go on to form the philtrum of the upper lip and the medial part of the maxillary bone, also the teeth. And that makes sense. As you can see, this structure here is in midline, and it's essentially the philtrum of the nose, and this will continue to form the upper teeth and the medial part of the maxillary bone. So what forms the lateral part of the maxillary bone? Well, it's probably whatever was lateral to these medial nasal processes, and that's going to be the maxillary prominences or processes, right? As you can see, these are going to form the lateral parts of the upper jaw and the lateral part of the upper cheek. So they're going this way. And so what happens with these mandibular processes? It's not necessarily the most relevant to this, but just in case that's one of the possible multiple choice answers on your multiple choice test, you need to know that the mandibular prominence or process actually has nothing to do with cleft lip and cleft palate. It goes on to form the lower lip and the lower jaw and the lower part of the cheeks. Also, we have this here. This is the nasolacrimal groove, and this is just a structure or furrow, I guess you could say, that initially separates the maxillary and lateral nasal prominences.
Turn on the lights on, carry on through.